According to Diabetes UK, over 9,000 people with diabetes in NHS England suffer a foot amputation every year, and many thousands more develop a foot ulcer. This figure is increasing relentlessly year on year, and the cost to our NHS is enormous. More than £1 billion a year, in fact, of which 2/3 is spent in primary, community and outpatient settings. At any one time, 2 to 2.5% of the diagnosed diabetes population have at least one foot ulcer, with the incidence increasing with age and vulnerability. Why is this? Well, of course, tight HbA1c control is key to reducing the risk of peripheral neuropathy and foot ulcers. But early detection of neuropathy is also important to allow interventions which may avert more serious outcomes. In primary care, standard testing for protective sensation uses a subjective test, the 10-gram monofilament or a tuning fork. These subjective tests require a reliable patient response, which may be hard in frail, elderly people in care homes or domiciliary care, and particularly for people with cognitive impairment. It would therefore seem logical to consider adopting a different yet complementary test to help screen for early signs of diabetic peripheral neuropathy. Neuropad is an objective test. It requires no patient to health care professional response. Although it's not yet a standard of care test, Neuropad has been recognised as having advantages as an adjunctive test and is available to prescribe. The National Advisory Panel on Care Home Diabetes recommends Neuropad as an adjunctive test to sensory testing for that reason. Now, there are also, as we know, large numbers of people with diabetes who don't routinely attend diabetes clinics to have an annual foot assessment. Likewise, those who have communication difficulties or mental health issues which affect levels of understanding or cooperation may be more vulnerable to foot ulcers, even if they're living in the community with home care. For these potentially vulnerable people, Neuropad represents an opportunity to offer an objective home test easily carried out by carers, which may highlight the importance of attending for healthcare professional follow-up. Neuropad uses lack of sweating at the microscopic level in the feet of people with diabetes as a surrogate for damage to the small unmyelinated C fibres which innervate the pseudomotors. As damage to these nerve fibres may occur earlier in the disease, they may be a valid indicator of preclinical neuropathy. For emphasis, where possible, the test should be used adjunctively with a test for sensory neuropathy, such as the 10-gram monofilament test. Neuropad has high sensitivity, moderate specificity, and particularly high reproducibility. It's also been extensively studied. Now, Neuropad isn't yet a standard of care test, and it's not intended to be a replacement for monofilament, but it does provide an opportunity to identify earlier signs of neuropathy, which may then allow patients to be identified for closer observation or further investigation. As I've mentioned, Neuropad is on the NHS drugs tariff and therefore can be prescribed and reimbursed. It resembles a sticking plaster but with a blue pad in the centre. You stick one on the sole of each foot, like this. You then wait 10 minutes for the test to complete, and then interpret the results. It's simple and painless, and the test can be carried out by patients or their carers at home. If they can put a plaster on their own foot or on that of somebody else, they can use a Neuropad. The test's also easy to interpret. There are only two possible outcomes. If the central blue pad changes to pink, that's a potentially good sign. But if it doesn't change completely or remains blue, this may indicate early signs of neuropathy. Now, of course, regardless of the result, it does need to be recorded, and the test repeated at least annually if it's negative. Early nerve fibre damage is almost certainly linked to inadequate control of diabetes and other metabolic markers. So you can explain to your patients that it's like an early warning system for feet at risk. And of course, the earlier you and your patients identify a potential problem, the better their chances of avoiding more serious problems later on. Because after all, as every doctor knows, prevention is always better than cure. For more information about Neuropad and the published clinical evidence supporting it, please visit neuropad.co.uk.